Another procedure we perform here at Premier is called otoplasty, or ear pinning. Oftentimes, ear pinning is something that is performed in children, usually just before they go to first grade. The reason for that is kids can be cruel to other kids. So when a young child comes into the classroom and has ears that stick out, we know the names that we hear, Dumbo and things like that nature. So we like to really have the ears repaired before the children go off to school. But nowadays, many adults are having them repaired also, in that they are hearing that this can be done easily without a lot of recovery time, and so we're seeing more adult patients coming in for otoplasty. How is otoplasty performed? Well, what is done is we take the ear where it sticks out and curve it back so that it has a more natural appearance from the side and from the front. This is all done from behind the ear. Now, in a child, we do have to have the child with some anesthesia, obviously to keep them comfortable while we perform the procedure. In our adult patients, we do this maybe a little oral sedation with a little numbing to the ears. And the procedure itself is very artful. It's done from behind the ear with small sutures placed into the cartilage to re-sculpt the natural creases that are missing in the ear. That's why it is folded out. These sutures stay in there permanently and shape the ear, and a small suture is placed behind just to close the small skin incision. The recovery times from this are very small, meaning we have a little puff dressing that goes over the ears. In the kids, we'll keep it for a week. In the adults, maybe 2 to 3 days, just to allow some of the swelling to go away. And then we take that off, and then the sutures are removed, and pretty much your new ears are ready to show off at that point.